My name is Christian Belknap. I'm going to be doing my assessment on my patient right over here. We're going to start with doing an assessment on the cranial nerves. We're going to start with cranial nerve number 1. I'm going to have you close your eyes, and I'll just have you close one of your nostrils here. And let me know when you smell something.
Hand sanitizer?
Perfect. Another nostril.
Hand sanitizer.
Perfect. And the second cranial nerve is already assessed through the smelling chart. So we're going to go ahead and start with 3, 4, and 6 cranial nerves, where I'm going to have you follow my finger with just your eyes, don't move your head. Perfect. And then I'm going to have you do perla on your eyes. I'm just going to flash a little eye in your. So your eyes just look on my nose here. Perfect. And just one more flash in your eye. Perfect. And we're going to do cranial nerves 5 and 7, where I'm going to have you puff out your cheeks for me. Perfect. I'm going to have you bite down. Perfect. And then I'll have you go to cranial nerve number 8. I'm going to have you tell me what side of the ear is on.
Both. Left. Right.
Perfect. I'm going to do, we're going to assess cranial nerves 9, 10, and 12. We're going to have you stick out your tongue. Do it side to side. Perfect. And I'll have you open your mouth for me and say ah. Perfect. And I'm going to look in your mouth and I'll just assess for hydration status, tongue, look at the tongue, look at the teeth, look at the tonsils. And then I'm going to have you do some more tests with me. I'm going to have you just flip side to side, just like this, like a pancake. And I'll do the other side. Perfect. I'm going to have you touch your nose, touch my finger, touch your nose, touch my finger. And I'll do the other hand, touch your nose, touch my finger, touch your nose, touch my finger. Perfect. Now you do one more test. I'm just going to do your thumb to your fingers. I'm just going to run as fast as you can there. Perfect. And then I'm going to go ahead and then assess, start with your hair and your head. And look at your hair, look at any abnormalities or anything like that. Check for any tenderness in the skull. And then I'm going to just look at the overall skin appearance. Is there any obvious cuts, bruising, color, anything like that? And then I'm also going to look in your nose here, look for any deviated symptom, any drainage or anything like that. And then I'll start looking at this here, looking for any abnormalities, redness, soreness, pain. And I can get my otoscope and look in your ear to look if there's any inflammation there. And I'll do that to the other ear as well. Look for redness, palpation, and look in the ear as well. And then go down to the neck. I'm going to palpate for any lymph nodes. And then I'm going to look for just tracheal deviation, make sure that's centered. Check your pulse. Check your other pulse. I could listen for bruit on her thyroid. Look for any bulging in her neck as well, just to make sure nothing's abnormal there. And then I'm going to go to the back of her thorax here. We're going to check tactile fremitus. I'm going to have her just say 99 for me.
99. 99. 99.
Perfect. I'm just going to oscillate breath sounds. We're going to have her do the whisper 1, 2, 3 for me. I'm going to have you breathe normally for me. just gonna assess heart and lung sounds as well up front, starting with aortic, pulmonic, Erb's point, tricuspid, and then mitral. I'm going to assess the extremities, run a fill pulse, check cap refill, check pulse, check cap refill, and then just palpate, look for any abnormalities there. Can I have you squeeze my fingers, pull me towards you, push me away, just checking for extremity strength there. And then I'll check the legs extremity strength. Let me lift the leg up. Check for pulse and cap refill as well. And I'll be push down on my toes and pull up. Perfect. And I'll just do the sign here. Does this hurt?
No.
Alrighty. And I'll do this leg as well. We're gonna check pulse of the dorsalis pedis and then cap refill as well. Do strength. I'll be pushed down and pull up. I'll do that same test. Does this hurt?
Mm.
Perfect. And I'll have you stand up for me. I'm gonna have you just, we're gonna do the balance test. I'm gonna just have you close your eyes. And have you lift one leg up and then slide it down your shin for me. And have you do the other one. Perfect. Now have you walk that way on your tippy toes, and then walk up towards me on your heels. Perfect. And have you go lay down for me. First thing I'll do is just look at the abdomen, look for any bulging, bruising, any abnormalities that would catch my eye, and then I'll auscultate the bowel sounds. And I'll listen to the aorta as well. Perfect. And I'll percuss your abdomen, looking for any abnormalities. Perfect. And I'll start right here, feeling the liver, any bulging, any soreness there. And palpate all 4 quadrants. You can start with the soft and go deep if there's any other any questions about that. I think that's it.